The hyperactivity is like in terms of jumping from here to there, that also subsided. At the same time, listening to instruction, he started following instruction. He was calm, he was happy, he was playing with other children. So you can imagine what the food has a role in our life. For example, I just give you again another example for us as an adult. Like, let's say if you are very happy, what we do? Let's go and have a party. Like in the office, you got promotion and you said, let's go and have party. So we go in the hotel cafeteria, we go and eat. So every emotion has a connection with the food. So I really request our parents that please try to focus on the food. Food is the main thing which helps in everything, not only behavior. Trust me, your life will be very easy. Right now, due to the corona, okay, now you have seen the majority of the time the kids are in the house. Now what is happening? And I know parents are having a very tough time. But if you had that routine before only, then those parents are not finding it challenging even if the children are at home. But I won't even blame them. You know, I can't say, oh, these people are not doing their job properly. Maybe sometime we don't have a proper support system. We don't have anyone to guide us. So, you know, this is a good platform where I have got a chance to share with you, because I was really thinking I wanted to do some awareness program, because I really feel for the kids and the parents. Parents are also suffering because they really want to do a lot for the child, but they are not able to do it because they don't know where to go, what to do, and how to do it. So first thing I really request to all the parents, please just see the diet not only for your child, but even for yourself. If you're not eating healthy, because here I've seen most of us are more into chips than chama, what you call chama or puffs, and a lot of crepes, junk food. These are the thing which is aggravating the behavior of the child. You can't discipline the kids if the brain is not calm, because our neurons, okay, neurons works. For example, if you drink a soda, what the flavor comes, okay, and after the flavor, if you see those bubbles, you know, it reacts to the brain. So the brain neurons, the way they are moving smoothly, it start moving like this way. So when a lot of neurons mix up with each other, this is the reaction which comes out. So we need to work on the diet part. That is the first priority which we should have it. Then this all behavior management, discipline, and all this thing come. And trust me, today we have COVID-19, okay? This corona thing has come up. There are a lot of things which are there in the life. There was a time it was completely locked down, not because of the corona, because of the other reason. So how much we are prepared for it. So this is the main preparation. Your parenting is the main preparation which can make you happy and your child happy. I want you guys to just write your experience when you heard the sentence, are you a parent? I would like to hear from you guys what thing is coming in your mind when you're hearing the sentence, are you a parent? Please text me on the chat so I can know what is going on in our mind. I'm sorry. Okay, I can see people are responding. Yes, I'm parent, I'm responsible. Okay, I can see that's a wonderful thing. Very nice. That's a very good confidence, which I really wanted you guys to have it. As I told you, everything begins from us. If we know we are accepting we are a parent, from there only we can do the role of a parent. Because there are many times I've come across cases like the mother doesn't want the child, but the father wanted, and they went for the kid, and they say now how we take care of the child. Because parenting is a partnership deed. It's like involvement from the mother and the father. It's not only the father or it's not only the mother. Generally, we have seen, let me just give you one very important point. When the child is small, okay, and if the child is doing something wrong, like for example, he's throwing a toy, okay, so I have come across many parents, they say, we say like, you know, it's okay, they're still young. And okay, for next question, I'll update you. let me just finish with this point. So there are many times, when the child is doing something wrong, or they are something throwing, or something they're hitting the parent when they're young for 2 years or 3 years. And I just ask them, how do you handle that situation? They say, yeah, but the child is a baby. He's a toto. That's the response which they give. They are still young. But trust me, the modification or making the child perfect, whatever point you want to put in the child, you can do it only up to the age of 7. If you want your child to be disciplined, okay, whatever discipline you will put at this period of time, it will stay throughout the life. If you want your child to be honest, if you are honest, they will also learn the honesty. And remember, this the basic period of year 7 till 7, they learn the things very faster. So we have to be responsible in terms of whatever quality you want in your child. Start implementing from the age of 1 year, even from, I can say, from the birth. It's not like that you have to start your parenting after the age of 7, because many parents said he's still young, he will not understand. Trust me, they understand everything. You must have noticed that. Let me not go very far. My own child is there, she's 2.5 year old. And I noticed one very small behavior when she was 4 or 5 months old. Below the sliding, I mean, the down, when we have a sliding windows, so there are tiny tiny particles inside. So I saw she was picking up with this finger. And I noticed that behavior, and I said, I'm sure this girl going to have a good grasping ability. I mean, even the eye hand coordination, like, when they're writing, they need to this. So I said, this is going to be there. You won't believe, she is 2.5 years, she can write. She has a very good holding on the pencil. This is our observation as a parent. Now, maybe because I know this part, because I'm into this field, but I'm just trying to say, whatever behavior your child is doing from the birth, from the childhood, please don't ignore. Even there are times I've seen her, she was playing with the hair. Hair, like when it has a lot of knots, she was trying to open it. That's called a problem solving ability. Now, these are the things which are being gifted to the child by the God when they are born. Now, how you are nourishing, how you are encouraging those things, that is more important. There where effective parenting starts. So none of the kids are dumb. No children. I won't say this child has a bigger brain and this child has a small brain. All the kids have same brain. So it is up to us how we are encouraging. Okay, like let's say at the age of 4 and 5. Okay, if you're making the child have a routine, like morning you have to wake up this time. You don't have to tell them verbally, but you're waking them up by 7 o'clock, then having a breakfast, then playing for a while, then after that they can sit and do some schoolwork, and then this is the routine which I'm trying to say. Try to encourage our children to go into extracurricular activity plays a very, very, very big role. Generally we focus on the academics. If you really want your academics to go high, work on extracurricular. Automatically academic will go improve. Because for example, even if the child has a stress, even if the child has any kind of a disturbance, if they are into extracurricular, it will resolve by itself. You don't need to go to any therapist or anything. For example, let me give you the water. Swimming. Here in Mombasa, we have a very good thing that our children are into swimming. Trust me, the way the outside atmosphere is, we don't know what is going to happen tomorrow. We should prepare our child from now. We should not wait for tomorrow. The way this corona thing has come up, we were not prepared. It came all of a sudden. So we should prepare our children for any kind of accident, and that thing should be done only by you. For example, you come to know that your child has an exam tomorrow, and if you came to know today, instead of you getting panic, you have to tell the child, don't worry, we can see how we can sort out. You have to immediately break the time in such a way that the child can get enough time to revise, enough time to go for his food and everything. So child is prepared to accept that all of sudden situation, so it doesn't become a trauma for them. Okay, so what I'm trying to say, the parenting is there till the age of 25. Many parents, they think that after the age of 16, 17, they are big enough to take care of themselves. Trust me, they are not, because their brain is still developing till the age of 25. We say the decision making ability. Okay, decision making ability of the child is developed even till the age of 20. It is not only the psychological, I'm talking about the neurological functioning. So if, For example, 17-year-old child come to you and say, Mom, I don't know which dress shall I wear. Okay. Or maybe the boys come and Mom, I'm confused. What coat should I go for it? As a parent, it is your duty to give them a support and a guideline. Okay. For example, if the child come and tell you about the dress, Mom, I have this dress and this dress. Tell me which shall I go for it. Then you can say, okay, fine, try one, and then you let's see how it is going. That's the support which you give. But many times it happens that parents, you're not a small now. You should take your decision by your own. You should know how to do it. Trust me, their ability is still developing. Even after marriage, children calls their parent and they say, Mom, I don't know, but I don't know, I'm really very stressed, I don't know how to handle this, I don't know what do I tell my husband. Instead of saying that, okay, fine, go and sort out with your husband, you ask, you try to listen to the child. Because I remember one case, and the mother was very shocked. She was around I think 20 years old, and she got married, and mother herself was a teacher, and head teacher, not even a teacher. And she really played a great role in child's life. But there was a time she was not happy in her in-laws house, and there used to be some pressure, but child was not sharing those feelings with her. And all of a sudden she got a call from the family in the morning time that your child has hung herself with the ceiling fan. And that was a big shock for her, and it is really touching. So trust me, our children need our support till the end. So what I'm telling you, I'm not telling you that give them all the things. Don't give them, but give them a support, because they are still seeking our guideline. And trust me, it really touches you, because when even I heard it, it really made me feel bad, that because I know that teacher, one who was there, she was so good in her schoolwork, she was so good in her duties, everywhere her work is to be up to date, and how even her kids were very bright, they were high achiever. But I don't know what happened which didn't allow, because I think so she told me that Mumtaz, there was a time she used to tell me that, Mom, I'm not happy, Mom, there is something which is bothering me. And she used to say that, go and discuss with your husband and try to solve. So see, I'm not telling you go and interfere in their life, but try to hear the child and give a solution which can help for the way. Hello, Patia, can I continue? I'm just confused.
Yes, Mumtaz, please continue.
Oh, I'm
Apologies,
sorry.
please continue.
Okay, I was just a bit confused. I'm sorry. Okay. So please play a great role in kids' life. Trust me, at the end, that lady, she still feel that, it's because of me. She's blaming herself. That Mumtaz, I feel somewhere I was liking, that is why I lost my child today. You see, this kind of a cases, many. Uh, I have come across a case of 1-year-old child who was being raped. And okay, the parents were living in a slum area, so mother thought, oh, child is playing outside, it's okay. She was busy in her work, so she didn't even realize that when the child was being taken by someone, and when the child was being thrown in the forest, okay, because she was living in a forest area. So that child was being raped and was thrown in a forest area. And that also they came to know when they heard the dogs were barking. So they heard the noise, they went, they saw the child was in a very bad condition. They rushed to the hospital, and the child was really in a serious critical situation. Okay, the child was safe. See, this is called parenting. That is the way we have to play a role. Sometimes we are
Sorry,
ignoring. Don't.
Mumtaz.
Yes.
Dear customers, please mute your mics. Please mute your mics for clarity. Mumtaz, please continue.
Okay, Sawa, thank you. Okay, my next question, which is going here, qualities which you have and it's being developed by your parents. Can you remember today your own parents? Do you remember, like, how your parents used to be so strict with you, disciplined? They used to get angry. This is the olden parents I'm talking about. Because today, like, I'm a parent, and I really miss my parents, the way they used to treat me. And trust me, it really helped me. I remember when I used to come back from work, my aunt used to tell me that it is your responsibility to clean the house. So you have to do it. That time it was really disturbing me because I'm so exhausted, I'm so tired, and still I have to do this work. But I was doing it by force. But today I think so that quality has made me tough. I'm able to manage my family. I'm able to manage my private practice. I'm able to do the work of consultancy outside. And I really am enjoying. I'm enjoying my work. I'm enjoying my parenting. So I think so it is more about the time management skill, which we should have it. Now, I think so all of you must be aware that, here we have a system of the house helper. But in India, we don't have house helper. None of the house help will stay there from morning till evening. So there, ladies, like especially the ladies, okay, they have to travel all the way for 2 hour journey for the work. So they used to carry the vegetables and everything, chopping and everything in the car. So in the train, so by the time when they reach home, okay, they just need to cook and keep it ready. But they used to manage. So the skill which every parent should have is about the time management. You should know how to manage your time. It's not only applicable to those who are working, but it's also applicable to those who are a homemaker, who are father, because your children needs you. I make a point that, once I come back home, I just shut down myself completely with the work because my children need my attention. My kids are very young, they need my attention. So, even my husband is there. I know he also needs my time. And trust me, that's the thing which release my stress. We generally say that even if you're a lot of stress, go and spend 15 minutes with the younger children, your stress will go. Go and spend your time with 17-year-old boy or a girl. Your stress will go. Go with them for a coffee. It really make you feel happy because you don't need to look that happiness outside. So everything is there within ourselves. It's only we need to search it and we need to work on it. So I really wanted to see what we people have written. Okay, I can see here people have written patient, generosity, God fearing, quality. I still don't carry on. Putting God first, honesty, hard work, patience, courage, empathy. Very good. Okay, now the question is coming back to you guys. Are we developing this quality in our kids? Give me the answer now. Are we giving this quality we are trying to put in our children today? I want the answer for are we putting this quality in our children? Please write for me that's like this way that I am putting this quality in my kids. Try to see and give me the answer. Okay. Mm-hmm. I'm trying very nice. We all are trying. Oh, thanks, Vatia, for reminding me. I know I have a last minute. Okay, let me rush. I'm sorry. Okay. Nice to hear. We all are trying. Okay. And we should keep that efforts, move on. Let's go to the next slide. Parenting style. And now this is something which is very important. I really wanted you guys to know about it. We have a parenting style. There are 4 types. One is called authoritative. If you know in which parenting style you will fit, you will know what kind of a children you will have it. Let's see the first one. It's called authoritative. Authoritarian, sorry. Now, these parents, can you see the picture itself is saying like, they are always like giving a lecture to the child. Listen to me. You have to do this. You have to behave this. You don't know how to behave. You are not listening me. You're not having, during our times, our parents used to tell, we used to do this. We used to do that. It's always the talk is on one sided. It's not on the both the sided. We are extremely strict and disciplined. Now when you have this kind of a parenting, what kind of a children will have? Let's see. Of course the child will listen to you, he will follow you, obedient and everything, but the trust factor which won't develop in the child because the relationship between you and child
They are
is,
working
but it's not that strong enough.
for
There will be no expression on the child. Child will not able to come and express him or herself
we
truly
need
in
to be
front of
silent. They
you.
are working.
They will be withdrawn. Today we have the cases of children are getting into drugs, getting into the rape cases, into the physical abuse, sexually abuse. Those are the kids who are coming out from here. These children are angry, they're aggressive, and of course they are not high achievers. You will find their performance is going down. This is about authoritarian parenting. Let's move to the next one. We
Yeah,
call permissive.
they are not doing anything.
Freedom
And they come and
without
they sit here the whole
limit.
day.
And if you try to see in this kind of a parenting, and I think many of us are following this nowadays, it's like, I should be very friendly with my child, so my child come and share everything with me. You should be friendly, but at the same time, make sure you are reminding your child that I'm your parent. Okay, so there has to be that respect. Can you see the way like picture is showing? It's like everything, anything is allowed. You're allowed to do anything, even if the from the school or from anywhere somebody complains you will say, leave them, they are like that. There's no problem. Problem is not in you, the problem is in them. We don't try to analyze from both the sides. This is what happens in the permissive parenting. Let's see what outcome we will have now with what will happen to this child. Here, I'm relaxing, I'm chill, let me just enjoy my life. So the child is into his own world because there's nobody to restrict him or her, and they don't even go and do any effort. They want everything like chips and soda is in their hand and let me enjoy my life. And that is what is happening right now. Now, these children, what happens when situation happens like Corona? Now, Corona is there throughout the day and night. They are just into TV. Parents can't control. Now here the problem is starting. So we need to start our parenting before the situation comes. We have to prepare our children for everything. Let's move to the next one, which is democratic. Democrating is in the middle, okay, and we say this is the best parenting skill where there is a restriction, there is a love, there is a guidelines, there is a parenting skill where you tell the child this is wrong, mean this is wrong. Remember, whenever you speak to the child and you tell the child, be firm and consistent in whatever you speak to the child. Make sure you're following that rule. I'm sorry, I'm rushing because we have a less time. Maybe if your bank will arrange another session like this, I'll definitely do it for you guys. No problem. Outcome. Now, this kind of a children, you will see them happy. They are high achiever. They are cooperative. You will find them. They don't find difficulty in getting along with anyone. They are mostly self-control. They are relaxed. High achiever. High achiever not only in academic, in extracurricular also. They are very good. And definitely all of us want this kind of a children. We don't want those two, which is what there before. Okay, I'm not going for this one. Let's move on. I wanted to discuss more about the myths and reality. Now, this is something very important for us to know. All parenting skills are instinctive. There are many parents, they have this thing that in a mind that, parenting, you don't need to worry, it's hereditary. So if your child is behaving badly right now, afterward he will be fine. You don't need to worry. But it's not true. It's not true because everything has other factors responsible for. No one is born with all the preparation needed to be an effective parent. Many parenting skills must be learned through gaining knowledge and experience. Try to seek knowledge from the expertise. Try to seek knowledge from your friend circle who are doing it. There is no harm in asking for a help. A mature adult can be a perfect parent. This is another myth. The people are saying that, if you have mature parent, they will be a perfect parent, but it's not true. Humans are not perfect, so no one can be perfect parent. Mature adults should strive to become competent parent, but not perfect parent. They try. Good parenting guarantees you good child. Let me tell you, many people think that, oh, my parenting is good, so I'm not worried, my child will be good, but it's not like that. Because it's not only your home atmosphere, the peer pressure, the external atmosphere. That's why I'm telling you, we should listen. Listening is the best skill which can solve your all the problems rather than talking. But majority of the parenting that I've seen, it is like talking is more, listening is less. Try to listen to your child, your partner, your kids, your guardian, whomsoever is there. Try to do that. Okay, this is what I already told you. Parenting is always fun. This is again another thing, like, people think, oh, that means there is some problem in my parenting because my child is not happy and I'm always fighting with them or they are fighting with them. But let me tell you honestly, there is none of the parenting which is always like this, the way that the picturing. There is always ups and downs. But of course, you should not leave that sadness in the house for a long time. I want to give you one very simple thing. Okay, nowadays the way our kids are, I have seen they are very outspoken, they are rebellious, they don't like. So these are the things which we need to pay attention. You can't be always ignored. Sometimes we say, oh, it's a teenage, so it is fine. No, even if it is a teenage, it is your duty to make the child understand. You don't need to fight with them, but you have to make them understand. And in case if it is not working out, take a support from the experts. Like for example, we are their professionals, so you can ask us to do it. Or maybe in your family, if your grandparents are there, and if the child is very close to them, you discuss with your parents and ask them that, why don't you make them understand. So these are the things which we need to do it to sort out these issues. It can be exciting, it can be boring, satisfying, frustrating, but we need to find out the way forward.
Anasema kuna mtoto mwingine alimoldiwa na umbo.
How your parenting can be good. It begins with understanding the stages of child development. If your parenting want to be effective and good, make sure you know what kind of a developments are happening in each and every stage of life. Many of our parents, they don't know. Even if your child has any issue, try to find out why, what, how, where. So if you know the answer for those one, your parenting will go very smooth. Healthy relationship between the child and the parents. That's very, very important. Now, healthy relationship, it doesn't mean that you have to allow the child to do everything. There are times when the child does a mistake, okay, you have to correct them. But at the same time, you have to tell them that this mistake should not be repeated, but you have to make them understand. Adequate exposure to the environment in which setting your child is, it's very
and you will never go outside, although.
Use your best thinking skill.
Sorry, Mumtaz. Hashi, please mute. There's somebody by the name Hashi. Please mute your mic.
It's okay. I'm sorry, Fatia. Okay. Use your best thinking skill. If you think like, let me try to sort out this issue, try to discuss with your partner, try to be open, try to improve your relationships. This is one humble request which I have from all the parents. I have noticed sometimes the father is the one who is playing majority of the role and mother is not there. Sometimes mother is the one who is doing everything, father is not doing there. Remember, it's a joint. The way we have account in the bank also, it's a joint account. You can't get the amount until unless the signature is from both the parties. The same thing happens in our child case also. So it has to be from both the sides. Sometimes being a parent, if you're frustrated, if you're tired of something, if you can't sort out that issue that time, please hand over to your husband, hand over to your wife. But don't make the situation more worse. Find the professional support and advisors, which I already told you. Build a support network for yourself. Now, support network in terms of try to engage yourself more into seminars, workshops, which can help you to move on, which can motivate you to do more for your child. And know your child. Please try to know your child. I'm not telling you to understand, but know your child in terms of what thing makes him happy, what is his weakness, strength, what is the thing which is he easily get influenced. If you know all this part, you can easily go for parenting. There is no harm. Okay, smiling together, singing songs, playing together with your child are most enjoyable moment of life. And I think it is very true. I would like to end my session. I don't know, Fatia, how much time I have. Let me end my session before parents run away from me. I would like to share this small video with you guys.
Okay. Yes.
Happy parenting. Here is the video.
Ameshakata. Kids level, okay? Did you see the way Hamza and Ryan, when they wake up, what they do? And then?
Thank you so much, everyone. And I would like to just conclude with one small sentence, not a small sentence, but I really request all the parents that remember how you talk, your sentence, your language, it matters a lot with your child, because don't use such word which can put a remark on child's life. At the same time, the parenting is everyday learning, it never stops. So if you guys really think, if you really feel that, I'm lacking somewhere, I'm missing somewhere, or maybe I want confirmation from someone that am I going on a right track, we are there to support you, to help you. Don't feel hesitant to approach or contact anyone, because it is for your child's life. Because tomorrow when your child will grow up, if he will be happy or she will be happy, you will be happy. So I just wanted to say that, like, parenting never stops. Keep moving and work together as a team. And I think after that, we will have a session with Winnie, who will take over. And after that, we will have a question answer session where we can answer your query. So I really enjoy being with you, and I'm very happy to see the participation which our parents have given. Thank you so much. Does physical beating and spanking affect the kids mentally? It does, okay, but depend what and how much. You see, that is what I'm saying. We will have a question answer session where I can answer you all the query, because I don't wanted you guys to miss other part also. So Fatia, please carry on and let Winnie can conclude. Otherwise, I'll finish here only. I will keep on talking. Thank you so much, Fatia.
Thank you, Ms. Mumtaz. We really appreciate great insights right there. I was taking a lot of notes. I was trying to type for the audience, but I fell short. We are recording, and we'll be sharing this. With all the participants who shared their email addresses, so that you can refer to it and also see what you can do. But great insights. One thing I have taken from your talk is the number one point of the diet. It's not a must to give them the Kinder Joy and the sweets that they keep asking for. We need to find a way of saying no, and in a good way, so that it does not affect them in other ways. Now I'll hand over to Dr. Winnie. Dr. Winnie, thank you very much. We have been seeing the talk about doctors. You're in the front line and trying to just help us go through this tough season of COVID. So Dr. Winnie, over to you.
Okay, thank you, Karen. Maybe I'll try to take about 20 minutes. We have had a worthy presentation from Dr. Mumtaz, and I think everyone has enjoyed, and we've got something. So my topic is on transitioning now to school. As we know, everyone is now very anxious. We're at a stage where we don't know where to begin. We don't know where to start. We are confused, and I don't know how much even teachers are preparing new parents to just go and see the class, the protocols, whether they are being followed and everything. My name is Dr. Winnie, clinical psychologist. I'm a resident at Aga Khan Hospital, Mombasa. Oh my God. Stop share, stop share. I don't know, Carol. I want to move to the next. Have I shared the screen? Can anybody see it?
Proceed to the next slide. We can see your screen.
Yeah, I'm trying to press the next slide and it's not coming in. I don't know. It's not going on. New share.
You want to present again? Exit presentation and then you present again?
I exit.
Exit the presentation, then try again.
Okay, now we're there, we are.
Yeah.
So most
Okay,
of us every day, yeah, we are waking up in the morning feeling defeated by life. We are overwhelmed by our failure to control anxieties and fears, and occasionally we are feeling very depressed. We are overwhelmed by the fear of future, feeling that we have nowhere to go and no possibility for better outcome in life. Everything we hold so much high in regard, plus an ending hustle, seems meaningless today because of what is happening. Now, the COVID-19 pandemic has unleashed an epic of proportions. This is what we call like tsunami and tidal waves. Every time we wake up, we're feeling up and down. It's really a roller coaster. The pandemic has revealed many things, and among them, our shared humanity and experiences of anxiety, anger, irritability, depression, because of what is happening. That is where COVID has put us. So as the number of deaths keep climbing, and now we are being told we're in the second wave again, fear in particular has dominated and it is very debilitating. So what are we afraid of? We are afraid of okay, so what are we afraid of? We are saying that given the magnitude of the present crisis, the list is endless. So we are afraid of the housing, the food, the security, financial security, our ability to cope with the future, our lives, our future of children. And as we continue now planning going back to school, 2021, the fear is there engulfing us. So the underlying of these fears is omnipresence of uncertainty, fear for the unknown. We don't know what's going to happen. Our children safe. Some people, I hear them say on the media that I cannot release my children. I don't know what is going to happen. You want to hold on what is yours. So are we safe even as we come to 2021? Many people also don't want even to go from 2020 because we're fearing 2021 may be worse. Those are so many lists is endless. So what are the issues here? Children have been disconnected from formal learning. Now most of our children are doing online learning. That is an issue. How do we transit from the formal learning now, from online learning to formal learning, knowing that there has been disruption here of the routines? They are now used to learning from home, which is different from the school learning. Issues and discipline and rules are very different. And I think if you agree with me, parents today have actually agreed that teacher and school plays a big role. What we have seen today in the world, and particularly in Kenya, we have accepted teachers do great job. Routines have been disrupted. When to wake up, when to have the breakfast, they watch media, they watch electronics up to very late in the hour. So parents here, parenting has really been an issue here, a challenge here, because you don't know what, they're not going out to play. There's no social connection. They want to watch this TV, but do you tell them to stop, go to sleep? They are very active. They don't know what they should do with the energies. So going back to learning with other pupils, students, or rebuilding social network is really a challenge to our pupil. How they have to relate with teachers again, that is coming to news, rules, regulation, and discipline, as Dr. Mumtaz has already said. Here we are going to have a lot of challenges because for 9 months, they were used to only parent, mother, and depends on how your parenting has been on discipline and rules. Now going back to school again, it's really going to be may be very challenging. This requires adjustment that may lead to experience of adjustment disorder. What is adjustment disorder in this case? Adjustment disorder happens to especially our children when they go to a new environment, when you are used to another environment. Some of the symptoms they will show is stomach pains, they'll have headaches. So your children will be coming with back pains. The children will be coming with even slight coughs. They're trying to adjust because now they were used to home environment, going back to school environment. So you're going to have children coming to visit their pediatrician more, visit hospital more, because of headache. Every morning they wake up, they are vomiting, or when going to school, they have stomach pains, they have back pains. Just know that that could be adjustment disorder, or we call them psychosomatic disorders, because they come due to anxiety or due to the uncertainty, what they are facing in school. They were used to other things, now they go back. So we have to really prepare them a lot. So children have been used to staying with their parents since March because of COVID-19. And going back to school may trigger also separation anxiety. Now, what is separation anxiety? Separation anxiety is a situation where a child feels that I am leaving the figure behind whom I've been seeing every day. And so I'm so worried when I go to another environment, that figure, that dad, that mom may be kidnapped, may be injured, may have an accident without my watch, maybe get very sick because I'm the one who is taking care of them. Children also take that, they assume that they're taking care of us. So when they're away from the parent, they're not seeing you every day, every hour, then that one gives them separation anxiety. They want to be near you where they know I'm in charge. Mommy cannot be kidnapped. Daddy cannot get an accident. No one can be sick. So imagine those who are going to Form 1, the 16-year-old, the 14-year-old, 17-year-old, they start getting sick and you don't know what's happening. It could be separation anxiety. So they are likely also to experience fatigue because of the long hours stay in school. Here they were used to short hours. They go to the fridge, they take some juice, they come back, they run around a bit, they go to the bed, they can sleep a bit, but now they are going physically to school. Fatigue is going to be very, very possible. And then experiences of bullies because structures have been disrupted. You don't know that when children went back home, and I've told you that parents in some one way or the other, it's like kind of we have failed. So these structures, because of disruption, the rules, they are not being followed. And so because of that, you're going to have children who are bullies. They may start bullying our children. They may start also telling them this and that. And then the children come home very anxious. They come home very, very distressed. You must be ready to watch this and recognize this. So reopening of schools comes with a unique responsibility for everyone, including the school, the parents, and the children. So here we are going to play as a role. We have now to team up so that we can make this thing work. This includes being open to new information. So parents, we have to be open. Anything can happen any day. So are we supporting our teachers? Are we supporting our children here? And are we also supporting ourselves? So following and modeling health protocols, that one has to. So during this season of Christmas, that one thing we need to do is, let's try now, we are teaching our children back again. Wash hands every 20 minutes, wash hands. And then sanitize. And then wear masks. And then social distance. That is what we are now closely monitoring and communicating our own health status and those of our households. What do I mean by this? Mommy, if you have a sore throat, please communicate it so that we see, could it be COVID? If a child, so that the child also will try to also be open. Remember here we are modeling. If you have a flu, please say it. Daddy, if you have some back pains, please say them. Don't start saying that, I think I have malaria, let me just take a nap, let me sleep. Daddy, communicate what you are feeling every day. Mom, communicate also to your children. So that the children can also learn to open up, because how Corona is setting in, it is setting in a very way that it is now not coughs anymore. It is suddenly pains all over, joint muscle pains, back pain, and then you start losing smell. Know that now COVID may be setting in. So once you communicate the symptoms, you'll be able to know and you take care of this COVID before it advances. So finally, understanding that families need to make also their own decision about sending their children back to school. When the time reaches, the head teacher has called you, go and check how are the desk arrangement, where are the washing hands, how are the toilets being arranged, the sanitizing, and who is in charge of what, which teacher, wearing of the mask, how safe are gonna be your children, so that we start controlling these anxiety issues. So just as parents have helped their children to cope with the pandemic throughout when you're in the house, by washing hands, remember what you have taught your children will never depart from them. What they are learning today, and I work in an hospital where even the prevalence, the issues of diarrhea, they have reduced because we are washing hands. Your children are the ones who are reminding us, let's wash hands. So what you are putting the values into them today and the morals, they will never depart. So this is going to be a generation of cleanliness. So there are ways you can help them also prepare in going back to school. So prepare that the fact that they are going back to school, they are not going to let off the hook. That washing hands, wearing the mask, social distance, my child go to school, but I'm giving you that, go with it and practice. So start sensitizing them right now, talking about it, having conversation towards the preparedness. This is the time. Remember, when they close on, those who are online, they close on 19th, it will only be 1 week. And after that, 4th, everyone is on their toes. So this is a time to start teaching your children and preparing them. So start talking about the protocols. What's helping is preparing them so that they kind of make a little mental makeup. And as they continue rehearsing, we are going to get a greater sense of psychological security. So monitor every day. 20 minutes, have you washed your hands, sanitized? Have you done this? Social distance, that is going to be your work now, whether for the adolescents, whether for the children who are going. So it's not like a holiday, kawaida. It is going to be a holiday, but you are going to be the teacher so that you can make them rehearse and rehearse and rehearse. So although parents have information about school opening next year, we cannot predict the challenges which can arise. And these challenges we can't predict are the ones which are going to bring anxiety. So we are imagining that when they mix up with other children, and we don't know where the other children are also coming from, are they going to contract this COVID or what is going to happen? So prepare your children for the times when plans will inevitably change without warning. Just like if a student in class tests positive, slowly, and don't put it to them in their mind in a way that you're scaring them. Remember, this talk is supposed to be in a relaxed manner. Remember, it's like a play. When you're playing with a child, you're washing dishes in the kitchen in a way that is not official. So when you are talking about the issues of COVID and reinforcing the protocols, please do it in a play manner. These are children. You may introduce the topic, reintroduce it again, although they know about COVID. You may reintroduce it to the children and their brain, and you bring scare, anxiety, or distress to them. So please make sure that you take care of their well-being. So prepare them, tell them in case a child or another student tests positive, do not worry, you shall just be isolated, and after 7 days, you go back to school in a play manner. So continue to sensitize, encourage, and let them know that even when the others down there are not following protocols, they are not supposed to mean that they should not follow protocols. So this is individual. That is what you should stress on them. If the so-and-so is not wearing mask, you just wear yours. If you notice the child is not washing hands, you just wash yours, my daughter. So it's about individual responsibility. And that is what parents, I want you to take up this season so that you put it to them and they rehearse and rehearse every day. So how do we manage the reopening now? Initial assessment of stay home for 48 hours. For example, if a child now they are opened on 4th and your child comes home and he says, Mommy, I'm feeling like there's a fever. Please don't tell the child, parents, we have a way of, there's exam. You're going to be, other people will do the exam and, other people will you'll be left there. There's no assignments. Please, let's treat this season very different. So in case your child is have a slight cough, let the child stay home for 48 hours. Do not push the child back to school. Meanwhile, check the high temperatures, monitor the child on chest and also the back, and have even issues of sore throat, any other symptoms which may manifest. After 48 hours, if symptoms subside, then the child can go back to school. But so this is not as normal. It's because we are treating it as it is a new normal, in the sense If my child says that he has headache, allow that child to stay home for 48 hours. Then after that, the child will go. They're not losing anything. It's just like us. We have been doing online. We have been doing a lot of this and that. We are not being also going too productive. Why? So the same way we expect them, even their grades to drop, accept them, allow them anyway. Do not push anything. So we have to reduce our expectation. How do we manage them? So just as many as adults have experienced productivity peaks or valleys throughout the pandemic, children are prone to the same phenomenon. They're not different from us. Therefore, parents, you may need to relax their academic expectations and focus on making sure that their children feel supported socially, emotionally, and psychologically. Let us adjust our expectations. My child used to be number one. My child used to have good grades. But now, this is a new normal. As they adjust, because occasionally they'll be coming out of class, they'll be doing this and this. This is a new normal. Let us just adjust. And so that we come over, we try to flatten the curve. When the curve will be flattened, this will be over and we shall go back to our normals again. So parents should allow their children to communicate comfortably with them, especially when they are feeling stressed or struggling to understand the lesson, concentrate on work and engaging back with the friends. I want to say one thing here, and I want to push in a question which was asked by a parent on sexuality. Now, it is you parent who is supposed to make yourself relaxed so that you can have information or anything the child will tell you. But if you're always looking like stone-faced and you don't allow your child to ask you anything, they are going to hide it and talk about it to their peers. And the same way also on you are struggling with this, how do I introduce it? The matters of sexuality, those who are the one who asking that question, sexuality is about my own health and teaching your child, your boy, your son, to respect other people's body and also your body. Let me respect my body, let me keep it healthy, all right? For a purpose which was intended to when that time comes, as you talk about it. However, parents, don't discuss the issues of sexuality to your child if you have had history which was not good about sexuality before and you never dealt with it, because you may pass the information in a very negative manner and then you make the child more scared. Remember, if you have an issue on sexuality, it can bring traumatic incidents. And so that trauma, you may pass it over without knowing. If you cannot handle that, just send your child to a professional and they'll be able to be helped. So a lot of time children needs to hear that their feelings make sense. So please, parents, respect the feeling of a child. Let them communicate a symbol like, I am feeling really anxious. Understand what is the anxiety about? What is happening, my daughter? Why are you worried? And then reassure the child. Start teaching your child to be more independent as part of the preparation. What do I mean by this? Now is the time we start telling your child, open your own the lunchbox, learn to open it for yourself. Shoe tying, because another child may tie the shoe and the child could be having the infection. So use your sanitizer yourself, open your own lunchbox, and just cover it nicely, wash your hands, do this, button your shirt. So let's teach our children who are small in early, the ones who are early childhood. But the ones who are at the other level, the ones who can, you just tell them, now make sure that you do most of the things by yourself. Let's not bang on other people because I don't know about the other child. And that's why in most schools, they have really tried to make the students have independence. Independence in the sense that they have their own biro pens, they are not now from the pool, they have their own rulers, they have their own books, they have their own rubber, they are no longer sharing. That's how they are managing in some of the schools. So educate their caregivers on matters relating on COVID-19, because these house girls are the ones who are going to receive your children from school when you are back to work. Now, they need to educate them on the protocol. When the child comes, immediately remove those clothes, put them in a dirty, where you put the dirty clothes. After that, wash your hands or sanitize. After that, you can also even decide to wash the body. Warm water, let the child just wipe the child with warm water before they settle down to have lunch. It is a new normal. Let us go by what is expected. Again, parents, we have been we are talking about this. We are ready to take our children. I know it's too much for you, but you need to take care of yourself. So you'll be able to help your kids better if also you are coping. If you're not coping, then you cannot teach your children. So children, you pick up your own response to the news. How do you respond to them? Are you disturbed? Are you quarreling? Are you traumatized? So it helps them to know you are calm as a parent and you're in control. If you're feeling anxious or upset, take time for yourself and reach out to other family or friends or trusted people in the community so that you can be able to share your predicaments. Make some time to do things that help you relax and recuperate. So keep up to the protocols also as you do it, because what you are doing, washing every 20 minutes, don't do it by mouth. You have to model, because children are looking at you and they want to learn from you. It is important to know that we are not leaving children in a state of distress. As your conversation wraps up, try to gauge your level of anxiety. Their level of anxiety, look at the children as you talk to them, see the body language, consider whether they are using, how is the tone of voice, see their breathing, how is it? That's when you'll gauge anxiety. Anxiety has to do with a lot of body tension, change in breathing, tone of voice, how are they behaving? Are they very tensed? Are they raised the voice? Then you know my child is really anxious here, and you need to sit down and listen to your child. Remind your child that they can have some difficult conversation with you anytime. So parents, be there for your child. Remind them that you care. And even you are as you listen, that you are available to get their worries anytime they feel like. Now, we have this other age, which is 14 to 17 years. And this is an age which you call middle adolescence. I'm just wrapping up. And they come with their own challenges. There are physical changes because of puberty is continuing to the late adolescence. So teens become more interested in romance. We cannot take this for granted. And also sexual relationship. So they get more stressed if they miss support from peers, family, and community. So parents, it's important actually to talk about sexuality and matters of sex to this very age group. More argument, you find them, they will argue with the parents more because of their cognitive, they're changing. So as they try, also struggle to get independence. So at this level, parents, you may be distressed and think your child is disrespecting you, but it's the developmental stage which is happening. You need to understand, but you need to be warm, you need to be kind. Again, do not counter attack. Otherwise, they'll be confrontational. I always say that parents, let's try to enter the child world. If we enter the child world, the child will hear us and the child will understand us. And also you'll understand the child. But if you stand at the side and the child is on this side, you may not understand each other. And that's why you differ at this age. And you wonder, where did I go wrong with my parenting? So parents, let us just take it as a challenge. And I enter my son's world and I feel what he's feeling. And the results are going to be positive. And the brace also, I'm saying here, it continues to change and matures up to 25, we were taught by Dr. Mumtaz. That is when the maturity happens, especially for the boys. So this time it's all a lot of changes, the brain changes, and a lot of issues, and you find that sometimes they lock themselves in the room, sometimes they don't want to eat with you in the dining room, sometimes they don't want even communication. Please, you need to understand this, the stage of development the child is going through. But all the time, parent, if you are warm, if you are kind, if you keep calm, if you model the right behavior, if you praise, if you show trust, if you show trust, and also if you are clear with your rules, if you are clear and you tackle problems in a positive way, then your children are going to follow you and you're going to follow your rules. And again, consistency. If you remain consistent with what you do, what you are saying, if this is wrong, it's wrong yesterday, tomorrow, and the next day, your children will learn. This is because they are still learning, but they'll do more through modeling and imitation. So parents, let's take note that up to this age is a different developmental stage, and it comes with its own challenges. Otherwise, for now, unless there are any questions, I would like to end there, and I'd like to invite for questions and answers. Thank you.
Thank you very much, Dr. Winnie. Very insightful, great insights right there. And I have personally learned a lot of things. I picked on separation anxiety, because I've been working from home, and the days I have to go to the office, I feel very anxious. And we think it's the children who will face it. Even the parents are facing the separation anxiety. So it's good to pick it. So when I did not realize it was separation anxiety until you mentioned it, and I said, aha, that is what is happening. And I believe that is what you're talking about, even knowing what is going on with us. Thank you very much. Great insights. We have 8 minutes to take questions. I think Fatia will type for us. I would like to hear your feedback about this webinar and what we can do next, what topics you would like shared. So Fatia will be typing our short code where you'll just send it, and we will see the feedback, and we'll organize another one based on what will be asked. So let me go to the chats. We have questions from, let me start from the top, where the first question was, I am a person living, sorry, you can hear my kids at the background. I am a person living with dwarfism, and some children with dwarfism have problems with lack of growth hormones. How can we help them at an early age? That was the first question about that. I don't know if it's Dr. Winnie or Mumtaz who will take that up.
Okay. Okay, the question which this person has asked, okay, it's a growth disorder, it's true. And the kind of assistance which he's asking, can I know more about it? What exactly he's looking for? Because when it comes about the development, because it's a growth disorder where, like, the body part is not developing that well the way other people are. The thing which you need to work more is to help them to be more strong psychologically, because when they are young it is fine, but when they start going to the school, like by the age of 7, or like when they start having the understanding, when they start playing with the peer group, okay, that's the time they start having the self-realization as, like, I'm shorter than this one and I'm different than these other people. Now how strong you're making that child psychologically. For example, if you have made them more engaged into extracurricular or academically, if you have made them strong enough into that one, that can really help you, help the child to be more stronger psychologically, and they can fight. For example, I'm not going very far. My own sister, cousin sister, she has a polio. Okay, so today she's a lawyer. Okay, now in her case also, we never made her feel that you have some disability. Never made her feel that you are different than others. This is about the upbringing I'm talking about. Even there are times when it comes about the house responsibility or anything, we used to give her that you also have to do it the way we are doing it. So we have not kept her behind any kind of work which we were doing it. So we have treated her normally the way we are being treated. So that really matters. Today, she is a lawyer by profession. She is working, and at the same time, if she is not feeling hesitant what disability she has, and in fact she can speak very openly, even if when it comes about the issue of the marriage also, she knows how to handle it. So it's like, how strong you're making the person psychologically, and that really matters, and that thing comes from the family. We have to empathize the child but not sympathize. Let me repeat this word: empathize the child, not sympathize. If you are doing that, let me tell you honestly, he will not face any challenges to face the world. I know one more person, okay? She has a cerebral palsy with multiple disorders. I'm talking about cerebral palsy, okay? She is cerebral palsy, diagnosed with the cerebral palsy with mild mental retardation. Now this girl, she is 17 to 18 years old today, and today, like, she was under my training and everything. Today she's functioning so freely. She can enter in the kitchen, she can cook the food, she can manage herself, she can work independently. Let me tell you, I have trained her for as an associate teacher, so she is working as an associate teacher. She can share her ideas. Her speech was also the issue, but now she can speak fluently. So see, it depends on the kind of atmosphere, at the same time, the professional support. I think these are the things which can help this child. I hope I have addressed your addressed your question, sorry.
There is a question about extracurricular activities that we can get with our children. I'm picking this question because it is general for all of us, and then the others will respond to them individually. So there was that one of extracurricular activities, a group, what we can engage our children with. And then there was somebody who mentioned that they have a daughter who is 12 and they are suspecting depression. Where can they go? I believe that is something that you can direct them directly to where they can go.
Okay.
So tell us about extracurricular activities, and we'll give the contact to the person who asked that question.
Okay.
Yes.
Okay. Can I answer, or Vinny, you would
One
like to
last
speak?
one, as you answer that, there is a question about hyperactivity. How do we deal with
yes.
hyperactivity as well? Yeah.
Okay, fine. Okay, first thing, if it comes about extracurricular, I really encourage all the children, because we have a plus point in Mombasa, that is a swimming. Swimming is the best thing which you can engage the child into, whether it is hyperactive child. When if you put the child into swimming, it really helps them to reduce the hyperactivity. At the same time, swimming can help to improve the concentration. Even if the person is in depression, swimming really helps extracurricular. That is why when I was saying that, if you put the child into extracurricular, the academic goes well. So the extracurricular helps the child to work out psychologically as well as intellectually. Also, the child grows. Okay, the lady who had asked for the depression. Okay, now first of all, whenever we diagnose someone depression, we really need to know what exactly the features, symptoms are, because depression is a very big term. Now, right now, if you try to see, like, somebody say, oh, she doesn't talk and she's sad and she's not getting involved in the family. Let's say this is the example. So in layman term, the meaning of depression is different, and stress is a different term altogether. So generally, depression goes into the neurosis level. We call it a neurotic disorder. So like, let's say it goes into the stages. We say little bit emotional disturbance, that's the first stage. When emotional disturbance is not handled well, then person goes into the stress, where they have mood disturbance like sadness, quietness, they don't talk much. But of course, the period, the duration for that problem matters a lot to diagnose someone as a depression. But if you have such cases, of course, we are there professional, like Miss Winnie is also there, and even I'm also there. So like, I'm running from my private practice currently. So as I have my own center, so you can get there, or maybe if you want, you are comfortable, but whatever is okay with you, you should take advice from the psychologist. Okay, even psychiatrists are there, but generally we work as a team. If there is a need of a medication, if the child need to be treated with the medication, then only we advise them to go for the psychiatrist. So even sometime when the patient come to us, okay, for the depression or anything, generally we do some assessment. It's called psychological test, which we do it. It's not something like I'm going to put the machine and I'll come to know what is happening. And it is not even a question answer session, okay? It's some form of a projective test, which I do it on the children as well as adult, old age. Even if the person will not tell me what problem he or she had, I'll come to know with the help of the test. And that's the one thing which will help us to know what is the cause of the problem. The way if you go to the doctor and you say, I have a fever, and doctor try to find out the cause of the problem, and then doctor work on the cause, not on the symptom. Same way when they come to us, okay, so we try to find out the cause of the problem, and once we know the cause, then we work on the cause and we treat the patient. So if you have something like that, okay, then I will really request you can consult a professional like psychologist or a counselor or a psychiatrist, okay, and that from there you can move on, because sometimes they need continue sessions or family therapies. And it's a better you take the professional advice in the case of a depression. And I think that's the question, isn't it, Carol? Or is there anything else which I missed out?
Yeah, so let me give my input on ADHD, the ones who have asked about attention deficit hyperactivity. Attention ADHD is a neurodevelopmental disorder which occurs to a child at 5 years. Any neurodevelopmental disorders, if the child grows nicely, you give birth, the milestones are okay, and at 5 years, things start happening. Autism, ADHD, learning disorder, communication disorder, any other disabilities and the other issues. So now it develops after 5 years. That's when you see And it has 3 stages. There is hyperactivity, there is impulsivity, and there is inattentiveness. Now, there are 2 types of treatments. And number 1 is psychotherapy, where you bring a child to be assessed by a psychologist, and then the psychologist will refer to a child psychiatrist who will give medication, because sometimes they are maintained by medication, but the psychologist will deal with the family on the behavior, on how to punish during, because children like that are very, very, they keep climbing, and they, even in school setup and everything. So the psychologist will work with the teachers, will work with the family in as far as punishment is concerned, so that they don't add more injuries to this child, and they may understand the disease even better. Thank you.
Okay, I just would like to add one more point, as Vinny has given the explanation about the neuropsychological. Of course, it is a neurological disorder. And at the same time, as I told you, and I have explained you the case of that child about the ADHD. ADHD, it's very, very vast term. Nowadays, like people are diagnosing ADHD with autism also. So we really need to find out if the child has ADHD, it is because of what exactly the cause is. Because sometimes the children will show the features of ADHD, and it may be a psychological. So we need to rule out first whether it is psychological or it is neurological. And on the basis of that, we plan the therapies, or if there is a need for the medication, then only we advise the children to go for a medication. Because hyperactivity also has the stages like ADHD. There's a mild, moderate, severe, profound. So these are the categories. Depend what level, what stage your child or adult is. There are people like adult also who have ADHD. So like, it's very important for us to know what is the severity. And on the basis of that, we can structure the program or the plan for the child, what treatment can work out best for it. So that's the way we can handle ADHD. Of course, in that there is a family therapy and the behavior modification comes. Then, even there is what you call cognitive therapy comes. So there are a lot, play therapy also play a great role in the ADHD. So there are a lot of things which play a role. So I think that's the way we can handle ADHD. But of course, take advice from the professionals. They are the only one who can give you the right direction. Thank you.
Thank you so much, Mumtaz. Dr. Winnie has to leave. As I said, Frontline, they have patients that they have to attend to, so she is just exiting now. We unfortunately, sadly, will have to wind up this very exciting session. We have so many questions, but one thing I have taken also from the ADHD condition, do not ignore any small sign that you feel is not normal with your child. But also remember, children have different milestones, but there's nothing wrong with asking for clarification or asking for help. Yeah. I see very many questions. Unfortunately, we'll have to wind up because of another engagement at 11:45 with the system that we're using right now. We will share responses to the individual people that have asked. There's one question I've seen also about children, 2-year-old and 5-year-old no, it was the 5-year-old that has started stammering. Maybe Mumtaz, you can guide the person on where they can get help, and then we take that as the last question, and I'll give it to Fatia to just give a vote of thanks to close.
Is it a stuttering or stammering?
Stammering. They have written stammering.
And how old the child is?
5 years.
5 years old. Okay. And I really would like to have more detail, because generally when it is a stammering, we take a lot of detail, like in terms of birth history, medical history, at the same time, like the milestone, and then when it is started. So, unless we don't have the whole case history, I can't give you the way forward. Because again, I'm repeating, stammering can be psychological, it can be neurological. Okay. So in case if it is psychological, then we have to do the therapies like play therapy or behavior therapy and all. And in case if it is neurological, there are sometimes we give some exercise also, which helps to reduce the stammering. Okay, so like generally, like, chewing gum, like that's just a small remedy which I can tell you. We sometimes advise them to eat chewing gum. You get it? Because that's exercise for the mouth. So it depends what it is, and like we have to go in detail.
Okay, okay. Thank you very much. Yes, we will be sharing the slides, we will be sharing the records, somebody has asked, and the records with the permission of Mumtaz and Dr. Winnie, it will have the contacts as well. Yeah, thank you so much. Over to you,
Thank you
Fatia,
so much.
one of our key organizers for this webinar. Fatia?
Thank you very much, Carol. To all our customers, thank you so much for making it today. Our speakers, Dr. Mumtaz, Dr. Winnie, we appreciate very insightful information.
Thank you.
To all our customers, we appreciate you. Thank you for banking with us. Thank you for being here today. We'll be sharing the recordings, of course, via email and the contacts with the permission of the doctors. So till again, one more thing, feedback, please share your feedback on our short code 21981. This will allow us to improve on the next webinar, and maybe you can even tell us what type of webinars you would want to hear from us so that we can make the necessary arrangements. So we appreciate you and thank you so much. You can leave.
Thank you. Thank you. Have a good time to everyone. Bye.
Thank you very much.
Thank you.
Thank you very much. Jazakallah khair.
Shukran.
Thank you.
Thank you.